As a parent that gets diagnosed with cancer and you have such young children, you start picturing like you not being in the picture and what that life is going to be like for them. And it's just so scary. I kind of dismissed myself for quite a while. I'm so healthy. This can't possibly happen to me. It's not colon cancer. I was more gaslighting myself. I am very much into health and fitness. I set foot into a gym when I was like 14, and I've been a competitive swimmer since I was 5. Very athletic, very into sports. I had what I chalked up to just basic pregnancy constipation, hemorrhoids, and like I didn't really think much of it, but I remember distinctively towards the very, very end, like I'm like talking like 2 weeks before my scheduled C-section, I had an episode of bleeding, and I at the time didn't really know where the blood was coming from, and I automatically assumed it was coming from the baby. So I went to the ER and they did a full workup, and she was like, "Oh no, it's just, hemorrhoids or whatever." And I just kind of left it at that, had the baby, went on with life. I never really had like a reoccurrence of those symptoms to be consistent and be fearful of anything. That was the biggest thing that was crazy to me, is that I didn't have any symptoms really. And when I had like the episodes of bleeding, it would come with like constipation. And it would happen once every 2 weeks, and then once a month, and then once every 2 months. It wasn't consistent. So it wasn't troublesome or scary to me at the time. The symptoms actually did pick up in 2024. They weren't scary. I didn't have any other symptoms other than just like what felt like constipation with bleeding. I did have a little pain on the right side when I would digest food. I was like, no, I'm so healthy. This can't possibly happen to me. It's not colon cancer. I'm too healthy. I'm too this. I'm too that. So I kind of dismissed myself for quite a while. Thankfully, I didn't dismiss myself too long, because I think if I had waited longer, this would have been a higher staged cancer, and this would have been a whole different conversation. The nurse practitioner was like, "I want to order you a colonoscopy." I'm like, "No, can I get out of this? Is there anything I can do to get out of this?" But honestly, now I will do a colonoscopy. I have to do one I'm probably going to push for every year for a while, and I'm okay with that. At the colonoscopy, it was only described as a polyp at the time, but it was 40 millimeters, so 4 centimeters, which is like a grape. So that's kind of what was protruding into my colon and causing the bleeding. Dr. Stern, shout out to him. He was very proactive. The second he got the results, he called me at like 8 p.m. with the results, and he's like, this is what it is. And he immediately got me in with a colorectal surgeon and an oncologist. Complete and utter disbelief, like absolute, just didn't make any sense. And when I first met with my oncologist and he physically saw me, he's like, this doesn't make sense to your overall, because he's describing like the risk factors for developing colon cancer, which is like, overweight, eating a lot of processed foods, not being active. And that's just like the exact opposite of everything that I am. He ended up taking my case to the tumor board. They all determined that the best course of treatment would be to get the tumor out first, and not try to hit me with radiation and chemo right away, because it might not be needed, because I was only technically stage 1 at that point. With colon cancer, the first place that it likes to go is either the lungs or the liver. So they were looking at those organs, extra careful as well. But because I had lung nodules, they were very small. I had to go see a pulmonologist for a bronchoscopy first. The pathology came back the next day after the bronchoscopy, and it was benign. Once I was cleared from the bronchoscopy, I could then move ahead with surgery, which I had already scheduled for April 1st of 2025. Meeting with my surgeon for the first time I think I just sat there like just a complete zombie. I was so overwhelmed with what he was telling me. It was a lower anterior resection with a temporary loop ileostomy, an 8-hour surgery. There's going to be multiple people involved. I remember going home and my husband and I just sat there in silence for like hours, like, oh my gosh, because I would have to have a temporary ileostomy to let the anastomosis heal on the inside. It was just I didn't know how to process the information. I actually packed like a full suitcase because I was told, hey, you're going to be admitted for probably 5 to 7 days. There's a potential for ICU stay. So I came fully prepared. You know, I had accepted at that point. At that point, I was just like, let's get this done. Like, this is going to save my life. This is important. I will say that I, I attribute it to being so active and healthy in my lifestyle choices that my surgeon actually discharged me the day after my surgery, which when I met with him later on, he's like, I don't normally discharge patients of this type of surgery the next day. But I mean, I was up walking, I was not in pain. The ileostomy was very easy. It was not as hard of a recovery as I had anticipated. I think I kind of expected the worst, but the worst didn't happen. My surgeon got the pathology back. He said, okay, it is a stage 2. I had 24 lymph nodes taken. None of them were involved. My tumor did have some characteristics that were considered high risk. I had to follow up with the oncologist afterwards, and he dropped the bomb of, you're 38 years old, you're young, you're healthy. Like, we need to be as aggressive as possible and give you the best possible outcome from all of this. So we did move ahead with chemo at that point. I remember just crying for hours after that. Like, I think I just had to like accept that this is what was happening. I'm glad I had a good cry, because after that I was like, okay, let it out. Now we got to just deal with this. Let's just get through this 6 months of chemo and it'll be good. I think that was honestly the hardest thing for me, because as a parent that gets diagnosed with cancer and you have such young children, you start picturing like you not being in the picture and what that life is going to be like for them. And it's just so scary to me. We did have the cancer talk with them. Not so much my son. He was just so little. He doesn't really understand. But my daughter, I didn't say the word cancer. I have such a hard time saying that word. I called it bad cells. Like, I had bad cells in my body, and like, we have to get rid of them. And this is how we're going to get rid of them. And this is what it's going to do. And she understood. I was set to do 12 rounds of Folfox, which is oxaliplatin, and 5-FU, which is a pump that I would take home for 48 hours. It was a little lemon. My kids put little googly eyes on it. He wanted to be very aggressive, and looking back, I really appreciate that my oncologist was so proactive. During the treatment, I'm like, this is awful. But I mean, I was still able to function at about 80% of my full capacity. The biggest thing with chemo is staying on top of your side effects. So even if like you don't think that you're going to have a side effect, take the medication that they give you. Take it around the clock. My whole face would turn red for 2 days, extreme flushing and heat. Like, I think that was more from the steroids though. I did lose 80% of my hair thickness. So that's why I have to wear it up. When I was actively connected to the pump for that 48 hours, I would be very tired. Feel a little bit nauseous, and the nausea was more like, it almost felt like pregnancy nausea, where certain foods will make you gag and stuff like that. Very manageable with the medications they gave me. And then the oxaliplatin, which was the aggressive one, gave me cold sensitivity in my throat, like extreme cold sensitivity. I still do have lingering neuropathy in my hands and feet. Now my lingering side effects is the neuropathy, and then my tear duct in one of my eyes is just constantly producing tears and mucus. I was at the gym with my pump on. I did not lift weights when I had the pump on, and I was very careful with elevating my heart rate too much, because the nurse did tell me when your heart starts pumping too much, the drug is actually pumping way too fast into your body, and it can cause like you to pass out, bad side effects. So when I had the pump connected at the gym, I would just go and walk on the treadmill like lightly for like an hour and watch Netflix and talk to my friends. As far as like the day to day, I mean, my life did not stop. Anyone that knows me will tell you they were just completely shocked by my ability to maintain normalcy in my kids' life and in my life. I mean, we were still social. I was still wearing a bikini with my ostomy. Like, people were just like, you are like insane. I'm like, I know. Towards the end, I started to get emotional, like, holy crap, I just like beat cancer, even though it didn't seem like that even happened to me, because I think I was in denial this whole time that I had cancer. Even though I'm going through treatment, I'm having surgery, I think I've been in denial. So in that moment, that's when it really hit me. And it's like, wow, I just did this and I cannot believe it.
Ring this bell 3 times well to celebrate this day. This course has run, my treatment's done, now I'm on my way.
It was such a happy moment and it was unbelievable. Like that feeling, that moment was top 5 moments of my life, I think. A lot of my husband's friends showed up with flowers and gifts. I had a huge flower delivery, chemo nurses and medical assistants and even the receptionist. They're just all so genuinely happy to see you like get to that moment. So it was very emotional. Things are starting to return to normal. Like I have all these hairs coming in, which is nice. I was finally able to have my port taken out, which was, to me, was a huge thing. Because like when you get that port taken out, the oncologist feels comfortable enough that this part is over for you. That was awesome. And then having the ileostomy reversed was great. So I really only had like a few weeks to just not have any medical care. Well, I can't even say that because my last chemo was October 13th, and then I had to go in for an high-pack enema to check my anastomosis, and then I had to have another colonoscopy to check my anastomosis on the inside. So I've had 2 medical procedures, a CT scan, more blood work, and then surgery. So I haven't really breathed yet. Like I haven't. I'm still in recovery from surgery. I have a drain still. You just forget what life is like before cancer. And like when you see the ending in sight and you can like, oh, I can return to like normal. I can have my beautiful hair again. I'll never complain about my hair again. Things I couldn't do, like getting my nails done, because your skin peels from the chemo. And it's just like things like that just make you feel good about yourself. You can go back to doing. You get so caught up in just the everyday hustle and bustle, and we go on all these trips and we do all these crazy things, and like I just never take a moment to sit back and enjoy those things. And I feel like now I really can. I really, every day is like, everything we do every day is like a treat. My biggest advice is feel all the feelings, like allow yourself time to be upset about it, grieve it, but then kind of put your pants on and get through it, because you have to get through it with a positive mindset, I think. I mean, it really helps the outcome. Do your own research. Don't dismiss yourself. If you feel something in your gut, have it checked out. It doesn't hurt, and it could save your life. I would chat GPT a lot of my lab work and stuff and just really kind of get to the root of my diagnosis, because then once I had that information, I could then go into my doctor's appointments feeling educated and being able to ask questions that I don't think I would have been able to ask if I hadn't done my own research. Block the noise from everyone else and stick with your gut. Find a care team that you trust. Be your own advocate always. You have to be mentally in a good space to be able to get through this. Like, don't get me wrong, I definitely had my moments where I was like so upset that this happened to me and I couldn't believe it. But for the most part, my mindset stayed positive. I tried to stay normal. I tried to keep normalcy in my life, and I think that really helped.
If you were moved by this story, we think you'll also enjoy this one, which we've queued up for you right here on your screen. Also, don't forget to subscribe to the patient story right here so that you can be notified about all of our recent uploads. Thank you for watching. You are not alone.